Objective 1 related to improving acute clinical outcomes for adults requiring acute spinal cord injury care. And this objective was particularly focused on the destination policy. And essentially the destination policy does appear to have facilitated early access to specialist spinal cord injury services. So direct admissions to these spinal centres is increased from 30% to 70%, and the time from admission to decompression, so surgery, is reduced from 15 hours to 8 hours, and both of those are significant improvements. There was some issues around, as I've alluded to in my overall video, that people with non-traumatic spinal cord injury don't appear to be have a clear pathway into these specialist services, and that's an area for further work. And also that people with incomplete levels of injury, and particularly if they've got pretty good walking function, don't necessarily always get linked into necessary services, or they might not get their psychological needs met as fully or addressed as fully as those with ASIA A or B scores, for instance. So our recommendations for Objective 1 were around focusing on reducing time to surgery, particularly for cases where an adherence to the policy does not ensure optimal pathways for the individual. So at the moment, there's very strict criteria about which unit you should go to when you have your injury, but that doesn't necessarily always mean that it's the quickest place for you to go to. So we thought there needs to be a little bit more work around looking at that. We felt there needs to be some more work around flexibility of pathway processes, particularly, as I've mentioned, for people with multiple health conditions, for people with non-traumatic injuries. And that sort of focusing on meeting the needs of those with these unclear diagnoses and dual diagnoses. So by that I mean something like spinal cord injury, but also have underlying issues, mental health issues, or spinal cord injuries, but also who have diabetes and other cardiovascular issues. So where there's multiple issues, that can be a little bit problematic, and is something that we felt needed to be worked on.